Assalamualaikum and a very good day to my supervisor Dr. Azmina and respected panel members. My name is Azmina Binti Mohamed Yunus from UiTM Shah Alam, and it is my pleasure to present my research titled Parents' Perception of Water Safety and Drowning Risk for Their Children. Now, let's start with the background of the study. Drowning is a major global concern with staggering statistics. According to World Health Organization, approximately 236,000 people lost their life to drowning each year. According to Medis et al. 2021, over the past decade, this has resulted in roughly 2.5 million deaths worldwide. The impact of drowning is particularly devastating when it comes to children. It ranks as the third leading cause of death in children aged 5 years and older, as reported in Social Determinants of Health study in 2017. Focusing on Malaysia, the situation is equally concerning. Malaysia has a lower drowning death rate for children compared to other Southeast Asian countries. According to the Statistics Department of Malaysia, there were 591 drowning deaths of children aged 0 to 40 years between year 2017 and 2021. So, to illustrate the real-world significance of this research, let's consider two recent incidents that highlight the critical importance of water safety for the children. These cases underscore the potential tragic consequences when water safety measures fail. First, on April 23, 2023, a woman filed a police report against a private kindergarten claiming negligence after her 4-year-old son fell into a swimming pool due to inadequate supervision. In another incident on January 30, 2024, a former nursery school teacher was accused of failing to properly supervise and care for a child over inappropriate period. This incident emphasized the necessity of proper supervision and care in childcare setting, particularly around the water. That is why education about water safety and risk of drowning is crucial to prevent such tragedies happen. Next, let's move to the research objective. There are three. First is to determine parent perception of water safety of their children. Second, to determine parent perception of drowning risk of their children. And lastly, to investigate the relationship between parent perception of water safety and their children risk of drowning in the UiTM swimming pool. Next, literature review. First, water safety. Water safety is defined by Works 2017, emphasizes the importance of water safety, which include recognizing aquatic risks, managing emergency, and first aid skills to reduce drowning incidents, especially among children. Understanding and implementing comprehensive water safety measures can significantly lower the risk of drowning. Next, drowning risk. Drowning risk involve potential respiratory impairment due to submersion or immersion in water, as defined by Young et al. 2007. Understanding this process is key to addressing the associated risks. The Center of Disease Control identified key drowning risk factors such as poor swimming skills, inadequate barrier, lack of supervision, and certain medical conditions. Addressing this factor through targeted prevention strategies is crucial for effective drowning prevention. Third, cardiopulmonary resuscitation (CPR). CPR is a vital life-saving technique that can significantly improve survival chances for people experiencing drowning or heart failure emergency. Patton et al. 2018 highlights that CPR can significantly improve survival chances in drowning emergency. This underscores the necessity for widespread CPR training as a critical component of drowning prevention efforts. Fourth, swimming ability. Swimming ability is recognized as a crucial skill for all ages, offering numerous health benefits and serving as a valuable life-saving skill. While swimming ability is important, research by Stallman et al. 2017 suggests that we should focus on broader water competence. These include not just swimming skills, but also water safety knowledge and emergency response ability, providing a more comprehensive approach to drowning prevention. And lastly, perception of water safety and drowning risk. Studies reveal significant gaps in parents' understanding of water. Many parents underestimate the drowning risk in common household areas such as bathtub and toilet by Daniel et al. 2019, and are unaware of how quickly and silently drowning can occur by Moran and Stanley 2006. These knowledge gaps can lead to inadequate supervision and safety measures, increasing the risk of drowning incident. Next, methodology. For this study, I employ a quantitative research design utilizing survey or questionnaire to collect numerical data for statistical analysis. I used random sampling to ensure unbiased participant selection. The study focused on 70 parents using UiTM Shah Alam swimming pool, providing a relevant sample for my research question. For the instrumentation, my questionnaire for parent perception on water safety, I take it from the journal Safe Living on the Water Age, Parental Perception of Total Water Safety by Moran et al. 2004. There are 13 items. For the questionnaire of drowning risk perception, I took it from the journal Influence of Water Safety Knowledge on Adolescent Drowning Risk Behavior by Low et al. 2024 with 12 items. So both sections I employ a 5-point Likert scale, which is 1 strongly disagree to 5 strongly agree. Data collection, I distribute a structured questionnaire via Google Form and collecting responses on site at the UiTM Shah Alam swimming pool. So data analysis, I'm using SPSS software version 28 to analyze descriptive and inferential statistics. There are 2 types of statistical analysis that I use. First, the study used descriptive analysis to analyze the mean score interpretation for research objective 1 and 2, while person correlation analysis is to investigate the relationship between water safety and drowning risk perception among parents, which is also to determine how these variables are related. Okay, now let's move to the result. The table show the result for descriptive statistic for research objective number 1, parent perception of water safety. So as we can see, swimming ability, the mean score is 3.98, indicating agreement on the importance of children's swimming skill. Second is role of supervision. The mean score is 3.66, showing agreement on the importance of supervision, though slightly less emphasized. And the general water safety issue, the mean score is 3.70, reflecting agreement on the importance of general water safety concern. Okay, next, the table show the result for descriptive statistic for research objective number 2, which is parent perception of drowning risk. So there are 4 factors. First is susceptibility to drowning. The mean score is 4.28, indicating moderate agreement on the risk of drowning. Second, seriousness of drowning. The mean score is 4.18, reflecting slightly lower agreement on the seriousness of drowning. Third, benefit of swimming. The mean score is 4.6 for showing strong agreement on the value of swimming skills as a protective factor. And lastly is perceived barrier. The mean score is 4.00. The lowest agreement between these 4, suggesting recognition of obstacles to implementing water safety measure. Next, result for research objective 3, relationship between water safety and drowning risk perception toward children among parents. Based on Conhan's 1992 interpretation, the correlation in my analysis falls under moderate because the range is from 0.3 to 0.5. So specifically, the analysis for my result revealed a moderate positive correlation between water safety perception and drowning risk perception, with a correlation coefficient, the R value 0.512 and the P value is less than 0.001. So this correlation was statistically significant at the 0.01 level. This means that as parents' perception of water safety increase, their perception of drowning risk also tends to increase and vice versa. Okay, next, the discussion for research objective 1, parent perception on water safety. The high mean factor is children's swimming ability. This indicates that parents highly value swimming skills for water safety. This aligns with Asia et al. 1995, who found that swimming lesson improved water safety skills and reduced drowning risk. However, Moran and Stanley 2006 warned that overestimating children's swimming competence can lead to a false sense of security, potentially reducing necessary vigilance. However, for the lowest mean factor is the role of supervision. This factor is concerning as it is crucial for preventing drowning. Peters et al. 2011 emphasized that inadequate supervision is a significant risk factor in drowning incident. The misconception that swimming skills reduce the need for supervision can result in dangerous situation, as noted by Morangiola et al. 2013, who found that swimming lesson might lead to complacency in supervision. Let's move to the discussion for research objective 2, drowning risk perception. The highest mean factor is benefit of swimming. Parents strongly believe swimming skills are crucial for preventing drowning. This finding support research by Stallman et al. 2017 and Moran et al. 2012, which highlight the importance of swimming proficiency in improving water safety and reducing drowning risk. However, for the lowest mean factor is the perceived barrier. This suggests that parents might not fully grasp the difficulties involved in maintaining maintaining consistent water safety practices. My finding aligned with Losey et al. 2014, who found significant obstacles like limited access, financial constraint, and lack of knowledge in Thailand. The underestimation of this barrier by parents highlights a critical gap in understanding practical challenges. Therefore, a multifaceted approach, including educating parents about drowning risk and the importance of proper supervision, is necessary to overcome participation barrier. Next, the discussion for research objective 3, I found a moderate positive correlation between parent perception of water safety and their perception of drowning risk. This significant correlation is supported by the protection motivation theory, Mohamed et al. 2018. This theory suggests parents who become more aware of water safety also become more aware of drowning risk, potentially enhancing protective behavior. However, the moderate correlation indicates that other factors also influence this perception, highlighting the complexity of attitudes and behavior related to water safety. Thus, interventions should address multiple aspects of parental perception and knowledge. Besides, parents who have better informed about water safety tend to have a more realistic understanding of aquatic hazards, leading to increased safety awareness and risk perception. This is supported by Moran and Stanley 2006 study, which found that greater knowledge correlates with more accurate risk assessment. In conclusion, parents at UiTM swimming pool recognize the importance of swimming skills but may underestimate the need for constant supervision and the challenges of implementing a water safety measure. The moderate positive correlation between perception of water safety and drowning risk indicate a complex relationship between these factors. This finding highlight the need for a comprehensive water safety education program that address supervision, practical safety measure, and overall water literacy. However, the small sample size and specific demographic of parents at UiTM swimming pool may limit the generalizability of this finding. Future research should include a more diverse sample to validate this result across different contexts. So that is the end of my presentation. Thank you so much. I appreciate your time and attention. If you have any question, please feel free to reach out to me. Thank you.